We will present the results of our long-term follow-up of patients included in the Clarity and Clarity Extension protocols. We will begin with the clinical and biological data. 10 patients were included in our center. The mean age of diagnosis was 38.1 years. All patients went from the Clarity study to the Clarity extension protocols with a mean treatment gap period of 322 days. One patient needed the rescue therapy with RB44 during the gap period. Last treatment tablet was administered from March 2008 to April 2010. Only 3 patients out of 10 needed another therapy since Clarity extension due to relapses. No patient entered in the secondary progressive phase. We had 1 patient with 1 pregnancy after the study period, with a normal baby without any specific disease activity for the mother. There was no specific adverse event. Only 1 patient presents still now a persistent grade 1 lymphopenia after 11 years without any clinical consequence. This busy table presents you the details of our 10 patients. You see that 3 patients needed another therapy since the Clarity extension protocol. 1 patient received recently a 5th cycle of Cladribine. We have 1 patient with a persistent grade 1 lymphopenia without any clinical specific adverse event. Here are the biological parameters with the total lymphocytes count for the 10 patients. We are still blinded of which patient received what and when during the Clarity and the Clarity extension phases. All patients received the active drug. You see the lymphocyte count during the first part of the study and during the Clarity extension protocol. But after a mean follow-up period time of 11 years, all patients went back to a normal lymphocyte count. Here are our clinical data with a follow-up period of 14.4 years. You see that the EDSS is extremely stable. Walking speed and hand dexterity are the same before and actually. 60% of patients were relapse-free. 4 patients experienced a relapse. No patients progressed to secondary progressive MS. We will show you now the MRI matrix long-term follow-up. First, we used the icometrics technology in order to evaluate the whole brain volume, the lateral ventricles volume, the gray matter volume, and the correlation between MRI atrophy metrics and some clinical variables after the Clarity extension protocol. You see the numbers are in the range of normal situation corrected for age. After this first evaluation, we decided to evaluate with another technology, with the ITK Snap free software, the lateral ventricles volume with a semi-automated segmentation throughout the entire period. So we evaluated the MRI metrics from the period before Clarity entry until now with a mean follow-up period time of 14 years. Here are the lateral ventricles volume throughout this period, with the first exam as the reference point. We decided after to take each exam as the reference point for the next one and we disconnected the group with patients who don't needed another therapy, and the small group of patients who needed another therapy. And we saw that there is a clear different dynamics of the lateral ventricle volume evolution between the two groups. In conclusions, 10 patients were included in our center. 7 out of 10 are still in a NIDA-3 situation. 3 patients required another therapy due to relapses. The MRI matrix showed that all brain volume, lateral ventricles volume, and gray matter volumes are within the normal range after correction for age after the Clarity extension protocol. Since Clarity entry, the lateral ventricles volume were normalized, and we saw that this parameter is extremely stable in the NIDA-3 patients group, whereas the dynamics of lateral ventricle volume evolution is different for patients who needed another therapy. So we have some data showing that long-term effects of induction therapy are very interesting and need to be explored in larger cohorts. Lateral ventricles volume follow-up could be a useful tool at an individual level.